Yeah, basically, you know how heavy cowboy boots are, right?
Yeah.
So it'll be boxes full of maybe 6 to 7 boxes of nothing but boots. And I'll pick them up, and then there's the heavy, very heavy area jackets. I'm picking those up as well, and the jeans. And the jeans, they're usually like 50 in the box. And I'm having to pick them up by myself without any help back there.
Yeah.
So I end up having to strain my back as well and get them out.
And this is how many times a day? Like how many days in the week?
Monday to Friday. Sometimes Saturdays that they bring in a lot of stuff on the Fridays.
So you bend and twist all day long?
Yeah. From 9 a.m. to sometimes until 7 p.m.
What do you do to rest your back or to make your back feel better?
Usually if I'm in pain, I'll just go home and my back will be hurting me, so I'll just lay in bed in a position that I always get into, and I'll just pop my back and I'm like, okay, and I just go about my day.
How do you pop your back?
I lay on my stomach and I basically arch my lower back and then twist and I pop it.
Okay, so you kind of do something like from here, and then maybe something similar to that?
No.
Don't do it, because then you might drop some of the thunder.
I don't. I just lay on my stomach and I just like arch my back a little bit and I just pop it. I figured out how to pop my back, so because when my lower back is hurting, it hurts to walk and put pressure on myself. So I figured out a way to pop it so I won't be in much pain.
Okay. Yeah, that is funny. Like if you find a way to pop your back, and I talked about this recently in detail with somebody, was you can relieve some pressure through what we call the facet joints. Where is it? Okay, this right here is called a facet joint, and it's the thing that makes it glide and slide, right?
Mm-hmm.
So that's a facet joint, and that'll crack. However, when we adjust the bone, right, we're gonna actually take this whole thing here, and not only do we crack this facet, but we also crack this facet. We set the whole thing forward, and we make the fluid exchange in the disc. Because you see, you want to avoid the discs. You know, it goes bone, disc, and you want to avoid these disc fibers tearing, and then this thing comes through like a herniation. You've heard of that before, right?
Yeah.
So the whole idea over here on this diagram is, even if you're lifting correctly, right, how it says correct and incorrect, every time you're bending and twisting, you're aggravating those discs and those fibers, and it's creating minor misalignments down here and putting pressure on the nerves. So the fact that you're in pain and trying to crack your back all the time for relief is basically your innate, right? Like what we call like our innate body, like our emotional response, if you will, like our body knows what to do. Emotional response is a bad example, but your body is trying to alleviate the pressure that it's developing from this. So I can help by properly adjusting down here to alleviate some of that constant pain and make it easier for you to do what you need to do. But of course, if you're bending and twisting 9 to 7, 5 to 6 days a week, you're gonna really need to just be careful, keep your back as strong as you can, and be very, careful. And I'll be here to provide you the relief for sure, and teach you some things maybe if you need to when it comes to some lifting. But I would definitely love to be able to help you, keep this part of your spine and everywhere else that there's pressure, but really focusing on their spine, with your low back pain.
Yeah, because I used to work out actually with Jackie and with my older brother, so they taught me the right way to like pick up things. So at work, I'm like, okay, so I know not to strain my back, and I try to do it, and I do it, but then I'm just like, it still hurts because box is almost 50 pounds or more. So I'm like, I can only do so much sit on myself.
Yeah, and that's the thing, like when you're doing a box and you have to lift over here, there's no avoiding the fact that the back is going to round a little. And even people that are lifting appropriately, so to speak, and they have their back straight and they come up, you can put a lot of pressure through the back erector muscles, as they're called, instead of like, cueing to push your butt back. It's a thing that a lot of people don't really cue. It's butt back on the way up. That's going to help you load glutes and hamstrings more, butt back on the way up, and it will take a little pressure off your back as you lift.
Yeah. Because there was a point where she stopped working out with us, and because we were doing nothing but weights, and my brother knew that we had back problems, so he had the weight belt, and he would make me put it on. He's like, I don't need you to strain yourself more than you already are. Yeah. So he would put the weight belt on me, and it helped me, and I'd come home and I wouldn't be in pain. Then I started working here, so I stopped working out, and I'm like, well, there goes all the training that he had done with me. Yeah. I was like, well, and he told me, you need the belt's right there. I'm like, I'm not about to wear a belt that's maybe that big over my shirt at work. And he's like, well, I'm just telling you, it's there if you want it. But I'm hard-headed, so.
Belt definitely will help you. I know a lot of times it's an image thing, and I know a lot of times comfort too. If it itches, it doesn't fit right,
it's usually, it was too big because it was for him. Yeah. And that's just the problem. The image-wise, I used to have to wear a brace on my knee because my kneecap isn't, well, the muscle around my kneecap isn't strong enough to keep my kneecap in place. So I used to have to wear the brace, and it was like a brace around this big. So the image, I'm just like, I'm over the images. I'm like, I can wear it, have no problem. But it's just the fact that how bulky they feel or how big they are, and I'm just like uncomfortable, so I'm like, I'm not wearing that anymore.
Have you ever been adjusted before?
No.
Okay.
I never got adjusted, but I went to physical therapy for a while for my knee actually. Yeah. And when I went, he told me that I had a lot of issues. So he was working, it originally was just for my knee. And I went in for my knee and would end up having to work on my right shoulder, my right hip, my right knee, my ankle, and there was times where he had to work on my back. But he couldn't do as much because, well, he said he didn't want to overstep since I was only going in for my knee. Yeah. So I was like, okay. And then I stopped going after a while.
Yeah, physical therapists, awesome for rehab. And a lot of times, like I said, didn't want to overstep. I don't know the situation, but a lot of times they're constrained based on like if there's a principal complaint and there's a doctor who wrote a script or something, and then there's insurance involved.
Yeah.
Yeah. So there you go.
I have Blue Cross Blue Shield, and it usually covers it. But originally, the reason I went in was because back then I used to play soccer and basketball, and I originally got sent over to a hospital for athletes because I got a 3rd-degree burn on my knee. Okay. So whenever I went in for this, they were like, do you have issues with your knees? I'm like, yeah. And they're like, okay, well, we're going to send you to the athletic hospital. I was like, okay. And when I got sent over, that's when they told me that my muscle around my kneecap wasn't strong enough to keep my knee in place. And from there is when they sent me to the therapist, and I was like, oh okay. I was like,
sorry, I didn't realize your sister might have locked herself out. Because pretty much like how it works, right?
Yeah.
So like we find the spots of the spine that have the most pressure. A lot of times, you know, certain sections can be compensating for the principal areas that are really hurt. You know, we're going to check very thoroughly with the scope, the palpation, specific adjustment, just like you witnessed. And then there's so many things we do beyond that. I don't do it usually on the first visit because there's so much time that we go into talking about things that we prepare kind of in a game plan. If it's like soft tissue for the knee, soft tissue for your shoulder, I'm going to assess your right shoulder, and I might even adjust it today. Okay. Because if it really does kind of pop and click and almost come out, so to speak, often we can probably address that. You know, don't be surprised if there's some kind of bodily change depending on when we adjust, especially, you know, through the mid to low back area. Because again, all the organ muscles and glands, right? Just to paint a picture for you, excuse me, I didn't even show you this earlier, right? All organ, muscle, and glands come out through here with the nerves that innervates everything from our brain, eyes, well, technically not our brain. The brain is our source that sends the signal down to the nerves from our eyes to our salvation, tongue, esophagus, heart, lungs, stomach, liver, kidneys, bladder, uterus, everything is innervated. So we're making big changes. And of course, that's why when it comes to just like working, like lying on the side, that's for that lower back and foundational kind of pain, because, you know, we got to get the pressure off the nerve and let that disc kind of heal. Because again, when we're bending and moving over here, these muscles are bracing and getting really tight, and everybody thinks they need a massage, and massages feel great sometimes they don't. But when these muscles are that tight, it's because the nerve is pissed off under the spine. And that's what we want to do, take care of that for you.
Okay. See, I hate massages, so I don't like them. So I'm like, I don't need it. I just pop my own back and go about my day.
No, makes two of us. Except me, I go to all my chiropractic friends and I'm like, please save me. And as you can see this? So here's your L4, L5, L3 disc, so to speak. This is your low back. Bending and twisting. Imagine all these fibers tearing all day long. Little tiny tears that you can barely feel. But it's resulting in an achy back. And all that inflammation that goes into the joints, these nerves get pinched and they go down and feed through your hair. And all those, so we want to de-stress that for you.
Yeah, about this one, yeah. There's times where I have really, really bad back pain to the point where even if I pop it, I'll still be in pain.
Yeah.
And it'll go through my entire back, and I'll usually be swollen all from this side over here. And this side, it'll be swollen, but it's not as noticeable as it would be on the right side. To the point where my mom, usually there's like Flanax, it's for swelling in your body. It's like a pill. And she'll give it to me. She's like, just take it and try to relax. And I'm like, all right. Usually it doesn't do anything anymore.
Okay. You're becoming numb to it.
Yeah. So I just don't take them anymore. I'm just like, no.
I know I can help make your back feel better, for sure. We can. I mean, again, with as much, the only difference is so far from what I'm hearing from her to you, other than just the areas and the chief complaints, is you, with your job right now, have a very, very, very specific kind of management, like maintenance kind of thing we got to do, because we got to make sure that you A, hurt a lot less. We don't want you back pain so much that you have to sleep on the floor and always want to pop it. And then B, that not only again hurt less, but that you work easier. You know what I mean? Recover better, work easier. So, all right. So, do you have any questions for me before I begin the exam?
I do not.
You okay?
Yeah.
What'd that feel like?
Release on it.
She's a person who tries to show not enough emotion, so
I don't show emotion at all.
Yeah, so if you see that she's not like praising you.
No, I didn't. I just
praises to you, but
no, one.
I stopped.
She doesn't show emotion. She holds her emotions in. Maybe you popping her back will make that little trigger, the little motion trigger come out.
I'm gonna roll you, but I promise I'll drop you. Okay.
You sure?
I promise. There you go.
Oh.
Emotion.
Yeah. You're like, I triggered it.
That one hit. Ooh.
I told you you felt dizzy too.
That's where we wanted to move.
Yeah.
Okay, that one was good.
Props
You're like,
to you.
there it goes.
Props to you.
You're like, See, now you're walking different.
Okay. Yeah.
Now I believe.
Yeah, she's a believer now. Keep walking a little faster.
Why you want me to walk that?
Because you're giving me anxiety.
Didn't you drink it?
No, you just keep breathing. You keep breathing. That should take a lot of pressure off your low back. Especially in the next day or two. I mean, you should feel pretty good down there. But that's like the initial. Like, we just basically opened up like this right here, this L5S1 disc space, this whole joint. All that pressure just came off that nerve. And again, so a lot of the muscles, I know it's not the right diagram, so if you look up here, a lot of the muscles back here that are just super guarded are going to be much more relaxed now, and you should feel better, you know. And that's just the goal, is to kind of find that right frequency and the right combination of adjustments to kind of keep you feeling better, longer, and eventually find the right exercises that will actually work and not the ones that don't, to help stabilize. But either way, I'm going to take a look at that right shoulder of yours.